Okay, we are, for all intents and purposes, live on YouTube for the COVID-19 virtual town hall for Coos Health and Wellness for May 5th, 2020. We have a very special town hall tonight. We are, as you can see, it's a little bit different than normal. We are joined by an esteemed panel of everybody at this point. We've got OHA Director Patrick Allen has joined us. The Department of Corrections Director Colette Peters is joining us. Dr. Daniel Dustip from Department of Corrections is joining us. Senator Arnie Roeblen, Representative Kathy McEwen, Commissioner Melissa Cribbins, District Attorney Paul Frazier, Brian, did I say you, Brian? Brian Leone, epidemiologist, last but certainly not least, and Barb Young, our American Sign Language translator. So we are going to get started. I believe Director Allen, are you going to go first with a short presentation, and then the Department of Corrections will then give their presentation right after, and then we will go into questions from our community.
Sure. Thanks for having me again. Pat Allen, Director of the Oregon Health Authority. I thought I would take just a couple of minutes to first give a little bit of a sense of where are we across the state in terms of managing the coronavirus outbreak. Talk a little bit about our role as an agency in support of Coos Health and Wellness as the frontline folks who manage the outbreak in Coos County, and then talk a little bit about the work that we've done with the Department of Corrections over the last month or so as there has been an outbreak in the Shutter Creek facility. First, from a statewide standpoint, we're at an inflection point, I guess is probably the best way to put it. Our number one mission for the last month or so has been to make sure that we preserve hospital capacity and didn't get overtopped and have some of the just horrific scenes that we've seen in other parts of the world and other parts of the country with hard choices about who gets served and all those kinds of difficulties occurring. And really thanks to all of you and thanks to all Oregonians, really achieved that mission by staying home to save lives, by doing the different kinds of business changes we have, by really doing all the very hard and very impactful things that have occurred. We really have flattened the curve and in fact have achieved our estimate, independent modelers estimate about 75,000 fewer cases than would have occurred in the state. That means significantly fewer hospitalizations, significantly fewer deaths. We have the 5th lowest rate of cases in the entire country. We have the 9th lowest fatality rate in the nation. And that's really due to the hard sacrifices that all Oregonians have made over the past little bit more than a month. That means we're now at a place where we can start basically turning things back on, reopening things. And the governor is in the midst of a careful process to be able to do that. There are going to be a number of things that need to happen for that process to begin, but it's going to begin in the next couple of weeks. The thing you're going to hear, you've heard lots about testing, I'm sure, over the last couple of months. The thing you're now going to hear a lot about is what we call contact tracing, the idea of identifying people who have cases, drawing kind of a circle around that person, and trying to provide the supports to quarantine or isolate people to make sure that those cases don't spread. That's going to become the replacement for some of the things we've done that have resulted in shutting down the economy, because we know we can't stay in this place forever. We're well positioned for that, but it's important to know that while we peaked in terms of hospital utilization maybe 3 weeks ago, we're not on a steady downslope right now. We're more at a plateau. We've come off our highest point, but we're really in a kind of a steady state. And that's where we want to try to stay until we get to the point that we're really aiming at, which is when there's a vaccine or treatments or those kinds of things to really ultimately put an end to the outbreak. So that's a little bit of a thumbnail of where we are from a statewide standpoint. Our role as a state agency is really to work and provide support, expertise, and services to the public health department in Coos County, because they're really on the front lines of dealing with these cases. When we talk about, for instance, contact tracing, it's county public health that will be doing that work. We'll be providing financial and other resources to help them expand that. One of the keys to being able to reopen things is a significantly expanded capacity to trace contacts, isolate and quarantine people, and support those people so they can stay in quarantine. We provide epidemiological and research support for local public health, and we're in virtually constant contact with them, either as part of the overall statewide system of local public health, or specifically in individual conversations with Coos County to be able to support the work that's being done there locally. And then finally, talk a little bit about our work with Department of Corrections at Shutter Creek. Correctional facilities are part of a category that we used to talk about as congregate living. I'm now kind of thinking of it as congregate living and working, because we're beginning to see cases pop up not just in correctional environments and long-term care facilities, but also in places where people work closely packed together, in places like food processing. Seafood processing is the most recent outbreak we've had up in Clatsop County. And so what we work to try to do, and we've had a great partner in the Department of Corrections working through this, is try to identify what are the best practices for infection control in a facility. How do you keep it from spreading widely in a facility? And what are the steps that you need to take to be able to manage that? And corrections, Director Peters or Dr. Dusnup can speak to this in more detail, but they've really created an aggressive system of taking people who are symptomatic for COVID, whether they've tested positive or not, and putting them in isolation facilities that are outside Shutter Creek, being able to do what we call cohorting. And this is something that happens not just in corrections, but in long-term care facilities as well, where you make sure that people who are in a population don't interact with other populations, and that's whether it's the staff working with individuals or adults in custody or residents in a nursing home, to try to make sure that there's not spread within a facility more than there already is. They've done a great job managing that process, and our role has been to consult our epidemiologists with Dr. Dusnup and other staff in corrections to be able to make sure that they're doing the very best practice around how they manage those processes. We've got a work group that's forming with Department of Human Services to think about people once they've been released from correctional supervision, to work on the supports that they need if they are still in a circumstance where they need to quarantine, to be able to support that. And so we're working very closely with corrections to try to make sure that we're doing the things we need to do to be able to support that population and control the spread of COVID. I think what I'd like to do is stop there and pass the ball off to Director Peters to talk in more detail about corrections at Shutter Creek.
Great, thank you, Director Allen, and you have been an incredible partner. We are so grateful for the partnership we've had with you during this pandemic, no doubt. And for those of you that are listening, we've already started thinking about what post-COVID might look like with our new partnership with OHA. I also want to thank the legislators on this call and the county commissioners for all of the time that you have spent with me working on this issue over the last couple of weeks. And so grateful for all of the phone calls that we've been able to have. Also grateful for today. This is something that we've wanted to do, and unfortunately a lawsuit prevented me from doing it any earlier than this week. So glad that we could come together live and help hopefully relieve some concerns and fear that some of your community members have, rightly so. This is a scary time. We're all in a state of hypervigilance right now, wondering what this disease is going to do in our communities and in our institutions. So really appreciate the opportunity to be here tonight. I'm also very grateful for the members of your community who are those frontline staff inside our institutions right now, our corrections professionals, our health services providers that are coming to work and working so hard to keep us safe and to prevent the spread of this disease. So we really have been working around the clock to prevent the spread of this disease in our facilities across the state. I know many of you, as I said earlier, have concerns. So I want to assure you, as Director Allen mentioned, we have been following CDC recommendations for correctional facilities and actually even going above and beyond their recommendations and seeking guidance from the Oregon Health Authority every step of the way. And so this includes testing of, he talked about contact tracing. This includes testing of all symptomatic adults in custody who are part of that contact testing of asymptomatic AICs. I'm hearing some feedback. Do we need to mute our phones when we're not speaking, perhaps? Or I might be the only one hearing feedback. But I wanted to first start with the updated numbers at Shutter Creek. We do have 2 employees who have tested positive. We have had 25 adults in custody test positive. We still have 20 tests pending, so those numbers could change when we hear back. We are now working with our partners at Coos County Public Health in order to
It would seem as though the director has frozen.
get tested. Just like everyone in the community, it's your choice to get tested. That is the same for our employees. We are encouraging them to get tested so they can stay healthy and continue to come to work. And so we're actively encouraging them and all of our team members also to share their test results with us so that we can assist them with pay and protected leave while they're at home recovering. We do report a lot of information on our webpage, including the number of employees who have tested positive. So for those of you that are interested for more information, we are updating that webpage daily. For our adults in custody, there are no limits on the total tests that can be conducted for our adults in custody. And thank you, OHA, who has prioritized the testing of those adults in custody. And also on our webpage, we're updating those tests positives every day as well. I'm happy to report there have not been any positive adult in custody cases outside of the one dorm at Shutter Creek. And I really think that is a testament to the cohorting that Director Allen talked about and the good work of the employees at Shutter Creek and our emergency command center that's been operating 24/7 now since the middle of March. I also know that many of you are concerned about the release of adults in custody in our communities. Please know that we cannot legally hold someone longer than their sentence length. And so we are still releasing 400 adults in custody into the state of Oregon from our facilities every month. But there's no wiggle room here. Once their sentence is up, we must release them back into their community. So far, we have released 23 adults in custody from Shutter Creek. 16 of those have returned to Coos County. And I know that there's been a lot of conversation around quarantining those individuals. What do we do with those individuals? As Director Allen mentioned, from a state perspective, we've been collaborating with OHA and DHS and community corrections. We've also worked very hard with the local health departments across the state to make individual decisions about what's best for these people when they release. And I think that's really important to understand that it can't just be a cookie cutter response to those that are releasing. It really has to be an individual decision. As an example, for one person, it might be important for them to be quarantined in a hospital, or excuse me, in a hotel. For others, it might be quarantining for 14 days at their mother's home. So what I can tell you is we are encouraging every single individual who's releasing from our prisons into our communities to self-quarantine for 14 days once they release. So with that, I will quickly turn it over to our infectious disease doctor. We are so fortunate to have an infectious disease doctor who's nationally renowned on our medical team, who has been holding our hand and walking us through what is our first pandemic. So with that, Dr. Dusnip, I'll turn it over to you to talk about what we do when individuals are coming into our institutions and what happens when someone tests positive.
Thank you, Director Peters, and thank you, Director Allen, for your remarks, and thank you everyone from Coos County. We are not happy that we have an outbreak in your community, and we remain committed to doing everything we can to controlling the outbreak. We have two main goals in our outbreak investigations. One is to prevent death from COVID-19, which is the name of the disease caused by SARS-CoV-2, which is probably is a bat mutation out of China. The next goal is to protect the vulnerable and to make sure, because they are the ones at most risk of serious morbidity and mortality from COVID-19 disease. So to do that, we have begun a series of steps since April 9th, on the evening of April 9th, when we learned from our collaboration with the Oregon State Public Health Lab in Hillsborough that the first patient there that was recognized was COVID positive. I was on site the next morning from Salem to Coos Bay, and we started doing symptom interviews of everyone in the institution every day, and that has continued on everyone in the institution, including the staff, every day since April 10th. As Director Peters said, we've identified a total of 25 positives, and we have 2 staff that have also tested positive. We are very, very proud of our nursing staff. They have buckled in, and despite many concerns that they have, which both included their work schedules, the time that they need to put into this, and the concerns that they have about their community relations. They want to be good neighbors, and they want to be recognized for the work that they do. We certainly recognize them, and we want to join with you in recognize them. Thank you for the good work that Coos County is doing to pass a recent anti-discrimination law. That's very good. I think it raises the morale of our employees, and we appreciate that. I would like to talk a little bit about our screening process. We use when we do the symptom interviews of everyone on every day, we use the screening recommendations of the Centers for Disease Control, and that includes fever or cough or shortness of breath, plus 2 of the following: fever, chills, repeated shaking with chills, muscle pain, headache, sore throat, and new loss of taste or smell. But we do go beyond those recommendations, as Director Peters has mentioned. We are, in fact, 3 of these people have been recognized not by any other symptom other than that they had a minor change of taste or smell, and they reported this to the nurses, and they were immediately tested, and they became positive. Every patient who is positive is immediately transported out of the institution and out of Coos County to our COVID-19 treatment center, which is in Wilsonville at Coffee Creek Correctional Facility, where I'm happy to report that although we've had 35 inmates to date who have become COVID positive, and some additionals that we'll be adding tomorrow from Oregon State Penitentiary, we have not had a death, and we have had 4 people who had more serious illness requiring oxygen, and all of them have been helped through amazing nursing care. We have learned that in our treatment of COVID-19, that the most important thing is to keep them hydrated, keep them fed, to maintain the medication regimen that they were on, treating underlying diseases, and that if we do this and keep them oxygenated, we have had a very good success in running them through the roughest parts of COVID-19. So to continue with the screening, again, the screening is done. The nurses are very good about that. There are times when inmates do not want to report symptoms because they don't want to be transferred. They feel that there's just a variety of reasons. We've even been told that they don't want to be tested because they want canteen tomorrow and they didn't want to miss their canteen. You can imagine we all have different triggers for our behaviors, and these are some of the triggers that the nurses are challenged with at Shutter Creek and are working through. We also, when they are, as I said, when they are positive, they go to Coffee Creek, and we have 2 facilities there: our infirmary for the sickest, and then we have a large quarantine unit. I think that's the best word for what it is for the community. It's a quarantine unit where all the positives go, and that is as intensive oversight, and the nurses are there in there multiple times a day doing screening, doing testing of them for their underlying diseases, and administering medications to keep them on track and safe as they go through their course. So I would also like to thank Brian Leon. One of our first calls after we've completed our first screening was to Brian. Brian, to his credit, was already burning the phone lines up as we were doing the first symptomatic screening, and he was wanting information. We have been as transparent as we know how to be as possible. We've not had anything from him. He has a good idea of what's going on at Coffee Creek, and we continue to want to inform him of all that. So without further remarks on my point, I think we were told that there would be lots of questions, and so I'd like to turn the time back to our facilitator, and we'll go from there.
Thank you very much, Dr. Dusnev. Thank you, Director Peters, Director Allen. We really appreciate your presentations on what you guys have been up to the last few weeks. I know there has been a lot of questions from the community prior to this and during this. So we will get started with some of those. I think some of them were answered. One question that I know comes up quite a few times throughout our week is and I don't remember hearing you answer this, but what's the thought process on testing adults in custody prior to release and keeping them separated from the rest of the population?
I'll start with that one, and then Dr. Dusnev, if you have anything else to add, that would be fine. So we are testing individuals who might be asymptomatic and are part of that contact tracing. So we have expanded in that vein, but we are not testing individuals on the way out. This might not be kosher, but I'm going to quote Director Allen with Director Allen on the phone. And his quote is, "Testing is not magic." And I think that's something that's really important to remember. We have seen cases in this country where people have tested negative in the morning and gone into respiratory failure later in the evening. And so what testing does is it only tells you something in that flash of a moment of time. And so we have not done that. We have not done that because it's not magic, but also because our doctors and our doctors at OHA have not recommended that. That is, as I said earlier, that'd be a substantial number of tests over time as we release 400 people every month into the community. Dr. Dusnev or Director Allen, anything you want to add to that thinking?
Why don't I go ahead, and then Director Allen, if he wishes. Yeah, testing is a concerning pit of snakes. We want to test. We would like a perfect test, but unfortunately we don't have a perfect test. And even if we were to test everyone, we could not guarantee that would identify everyone who has not only the presence of virus, but actually a replication competent virus, which would be someone who would be considered to be infectious. We have certainly been very closely working with our colleagues at OHA and working to find the right definitions to use and the right populations to test. We have extended, as Director Peters says, we have extended testing into the asymptomatic population to give us an idea of where the safe spots are, to where we could, turn our attention to increasing social distancing and hand washing and all the public health simple but important interventions that keep people clean. As of now, we do not have any cases other than on Charlie 3. There are 2 other housing blocks there, but that may change at any minute. But we have not found that, and we do not see support in the literature for testing to be the answer to all our problems. What we believe is more important, or even as important, we believe that assessment of risk every day and clear communication to the counties of origin where these AICs, the adults in custody, will return to, and a clear statement that these people came from a place that it has high risk for exposure to COVID-19. And when they get out, they may well be transmissible. They may well be contagious. And so that needs to be taken into consideration. A test won't tell us that, whether they're contagious or not. It will tell us other things. But because of that, we are not hanging all our eggs in that basket, so to speak. I'll turn the time over to Director Allen.
Yeah, I don't have anything to add to that.
Okay.
Thank you. I have a non-Shutter Creek related question. Exactly, Commissioner. I feel we have a couple questions that are fairly similar regarding the reopening of things like beaches, small businesses, tourism in general. Is that something that is upcoming for our area?
I can take a little bit of a crack at that. The governor's been working on a set of prerequisites that need to be met, and then a phased reopening plan once those prerequisites are met. And basically, it's a combination of statewide, do we have enough of a decrease in the presence of disease? Regionally, do regions of the state have adequate hospital capacity and adequate access to personal protective equipment supplies? And locally, do communities have the ability to test and trace and quarantine and isolate potential cases to control any potential outbreaks? Once those criteria or prerequisites get met, then each county individually or groups of counties together will be able to apply basically to move into a phased set of reopenings. That's within a context of some things that have already been reopened on a statewide basis. As of last Friday, medical, dental, and veterinary providers have been able to begin to resume, at least in a limited fashion, elective procedures. Today, the governor made an announcement about certain recreational facilities beginning to open, and I think you'll continue to see that occur. Tourism is an interesting challenge that I think will really be managed in a state and local partnership fashion, because you have parts of the state that are eager to begin to open things, and other parts that are really concerned about a big influx of tourists from either other parts of Oregon or elsewhere in the region. And so we're going to have to work together to manage what that looks like and how that impacts. I think especially coastal counties in different parts of the state. But the governor will be announcing more on Thursday about the phased nature of that reopening, and so I'll look for more information about that.
And thank you, Director Allen. I can say from the county perspective, we are working on our phased reopening plans, and we're grateful to the governor's office and of course to OHA for the work that they've done in getting us prepared for that. We will be having discussions at tomorrow's meeting about our phased reopening plan for parks. And we're discouraging tourism promotion right now. We think plenty of people find us without any encouragement. And of course, until those restaurants and beaches and all that are open, it's not a great place to come visit, right? Because that's why people want to come. Thank you.
And this is Senator Roblin. I just wanted to say a couple of things. I have been on the Economic Advisory Committee for the governor. She got that started a number of weeks ago, inviting people from all of these different categories of businesses that have been closed, and recognize that in our state, we didn't close all of our businesses. So construction has continued to go. We've done a lot of different things. Counties made their own decisions. So both in Douglas and Lane County, they didn't close all of their housing and their hotels. Most of the rest of the coast did. But we have been working on reopening restaurants, outdoor recreation, retail, childcare, transit, and personal services. And each one of those has a separate group that's been working as a subgroup to come up with what are the things that we need to consider and what are the best practices around the world, around the country for reopening those programs. They have come out with some recommendations. Those have gone to a separate group of health professionals. I think Pat Allen is part of that group that looks over all of those recommendations and then comes out with some frameworks for each of those different programs. And it's been a pretty intensive group working throughout the state. There are regional cooperatives that are adding information to that. So if you look at all of our regional groups, they are putting information in. We're getting lots of input directly from restaurateurs, from hotel people, from childcare facilities. How do we go about doing that? And I think that's been a real strength in coming up with a plan for reopening, which we hope to hear from the governor more this later in the week.
And thank you. First of all, thank you all for being here. This was such an important meeting for our community, and we're really delighted to have you here with us tonight. One of the things that we've been working with as coastal legislators also is trying to understand the coordination of how we begin to open the coast. I'll give you an example. We have city parks, we have county parks that are day parks and camping. We have state parks. We have federal venues like the National Dunes Recreation Area, our Forest Service campgrounds. This is a really complex piece of work out on the coast. And one of the things that the coastal legislators wanted to be sure of is that all of these entities, our cities, our counties, our federal partners, our state partners are all coordinating how this happens. So a lot of thought has been going into this, and I think we've been clearly assured that communications are strong between all of these entities, that if it's not handled correctly, you're going to put pressure on points on the coast that are going to create some problems. But it's been really assuring for me to watch that the coordination is occurring between all of these organizations at all levels. And it's a very complex piece of work, and I appreciate the work that's going into opening and the thoughtfulness that's going into the opening to make sure that we're not only getting some oomph back into our economies on the coast, but protecting the folks that are here.
Thank you. Where's my question? Okay, so there's been some questions regarding AIC numbers and then how they're directly related to the numbers that Coos County reports. And I think that is a question that a lot of community members have. And one that posed a question here is, can the COVID numbers be broken out to show Shutters Creek versus the rest of the county in the daily report? Also, why is Coos County being stuck with AIC numbers who have been moved out of the area?
I'll take a crack at that. First, we at the Health Authority would not break those numbers out. The data is considered confidential, and splitting it that way would violate that. I think Corrections has done a good job of announcing on its own the numbers related to adults in custody and staff. I think maybe the underlying question is, will those numbers count against some criteria that we have around reopening for having a low threshold of cases? And the answer is no, they won't. We will be able to recognize the fact that those adults in custody have been moved to Coffee Creek or wherever they might be. and really look at the remainder of cases in Coos County to be able to assess those thresholds.
Brian, you have any follow-up?
No.
All right. That, I think that followed, another question that had kind of directly related to that was, and you kind of spoke to it slightly, Director Allen, is that once you break out, it's not enough to change the reopening possibility. Someone had asked, now that we have a case that seems to be disconnected from Sugar Creek, there are some concerns in certain pockets of the community that our numbers may go up. And would that change the direction of the reopening at all?
Yeah, so I can't speak to specific individual cases, but I would say a couple of things. First, as I look at the number of tests and the percentage that are positive in Coos County, I don't have the number right in front of me, but I believe it's at or below 5%. 10% is considered a positive rate that becomes a concern that you're not testing enough, and there may be pockets of undiscovered disease in a community. So at 5%, we're not concerned about that. And while our cases have been low in Oregon, I guess it's really important to remember that COVID is present throughout Oregon. There are a small handful of very rural counties that have not had a case at all, but there are cases throughout the state, and so it's tempting, but I think not accurate to try to put a finger, unless you can draw an epidemiological link specifically to where cases come from. That, I mean, that's part of what we talk about when we talk about community spread, that there are cases present generally, and I think I think that's a potential all across the state, and it's really the potential that we are trying to work to make sure stays manageable as we look at contact tracing, quarantine, and isolation moving forward.
All right, we've had, gosh, I want to say about 4 or 5 questions regarding the testing of staff at Sugar Creek, and I know Director Peters, you and Dr. Dusup, you kind of touched on it a hair, and even Dr. Allen, about how testing isn't necessarily magic, but there's questions as to regards to why the entire staff hasn't been tested, or at least all of the staff that were on C3 with the presumed outbreak is at.
So I'll take a first stab at that. For individuals who were deemed to be close enough to someone who tested positive, they would have been excuse me, flagged in the contact tracing and would have been asked to have been tested. We cannot mandate our staff getting tested. We do not provide health care to our employees. They have to rely on their local healthcare provider to make those determinations. But we have encouraged people who were considering getting tested to get tested, so that hopefully they test negative and are able to return to work, or we're actually able to help them with their medical leave and assist them while they heal and work through the disease, like we've seen with the 2 employees that have tested positive so far. Dr. Dusup, anything else you want to add?
Just that, as you reiterated, Director, testing is voluntary but highly encouraged. And we have given, under OHA's guidance, we have provided a letter of priority testing that can be completed at the Oregon State Public Health Lab at no cost to the individual, that can be directed through their both their primary care provider, and you may, Brian may wish to discuss areas in the community where they could be tested also outside of their primary care provider. We are talking to the staff every day about symptoms. As long as staff are asymptomatic, they're able to return to work, and the contagiousness is considered to be low. And so, but we encourage anyone who wants to be tested to be tested.
Yeah, sure. So part of that process, when there were staff that were identified to be COVID positive, was to have our team of investigators also separately interview all of those staff members, have a really good and open confidential conversation about any symptoms they may have had, any exposures that we would potentially want to be aware of should they end up, being recommended for testing and testing positive and going through that process. So our investigators did a great job establishing rapport with staff and also discussing potential avenues for getting tested, while underlining the fact that the testing process was their choice and that it would certainly be a confidential process from step one to end.
Great.
Okay, I have a question that's more directed towards Brian, and it is regarding the female that was tested positive recently in the community that is no connection with the Shutter Creek Correctional Institute. The question is, was the contact tracing done on her movements, and are you allowed to tell anyone where she went, say stores?
No, we certainly can't delve into too many details about potential places of exposure. I will say within an hour of learning of her positive test, a lot of work was done in terms of speaking to her and speaking to other individuals that there may have been contact for. We've completed interviews with a very, very small list of people that she could potentially have had contact with. And that includes even someone that just had a very brief interaction, was within just a few feet for maybe 5 seconds. And then, within about 10 feet for less than 5 minutes. That we try to be extremely thorough about any potential exposures that may have occurred. We've, like I said, interviewed a handful of people. One of the great things about this individual was she's been extremely vigilant about all of the measures that public health has guided our community for in terms of social distancing, hand washing, sanitization of high-touch surfaces. So there's a couple of sides to that issue. One of them is the fact that we are extremely confident that outside of the household, there's probably not going to be any additional cases. So stopping that in its tracks just by her behaviors and her care is going to be a very positive outcome, most likely. It also has kind of had us scratching our heads a little bit as to where she may have contracted the illness, because she has been in very few places and has been very careful about what she's worn outside of her home. So there's still a couple of different avenues that we're looking at in terms of trying to figure out where she may have contracted COVID, but right now, they would all be considered long shots at this point. So this may be a case where we don't quite figure out exactly where it came from. But again, the positive part of that is we're pretty confident that it's not going to go anywhere from there.
If I could just add, not specifically to that case, but in general, I think sometimes there's a little bit of a misconception when we have things like a measles outbreak. We do tell the public where someone has been. They were at the airport or at a basketball arena or something like that, and that's because measles is 3, 4, maybe 5 times more contagious than it appears COVID is, and it transmits through virus that is an airborne particle that can hang in the air for long period of time after someone has left. And that's why in those cases we do talk about where someone has been. The mechanism of transmitting this disease is significantly different, and that's why that's not the kind of information that helps people understand whether they've been exposed to anything like the same degree as a disease like measles. But that explains the difference why sometimes we talk about that and sometimes we don't.
Thank you, Director Allen. That was actually great information. I think there's a lot of people that have posed questions similar to that, and I hopefully they were listening and they got to hear that explanation. That was great. Now, is it true that a person can be asymptomatic and also contagious?
So this is Dr. Dusnump. Let me shed some light on that. There are two phases. There are actually three phases of the disease. One is the pre-symptomatic phase, the symptomatic phase, and then the post-symptomatic phase. Shedding of the virus and contagiousness is thought to occur at the highest likelihood about 2 days prior to symptoms, and then during the symptomatic phase, and then after the symptomatic phase starts to ebb, there's a long period, as long, anywhere from a week to 10 days from the onset of symptoms to a lesser amount of longer shedding of virus. Now, we don't know everything about when it's contagious in the post-symptomatic phase, but we think it's contagious for a while as the symptoms begin to ebb. And we do know it's contagious during and within the 48 hours before. So that's the model that we use to do contact tracings and identify individuals at highest risk of exposure.
It's also, if I could add to that just a little bit, it's also part of the trickiness around testing and the value of testing asymptomatic people. There does appear to be a fair amount of evidence that in that pre-symptomatic period, it's easily possible that someone has and is shedding virus, but doesn't have enough of it in the upper respiratory tract for it to show up effectively or consistently in the nasal pharyngeal swab kinds of testing that we're doing. And that's why if you get a positive test, we're pretty sure you've got COVID. But a negative test is much less certain than that, both in terms of you could be subsequently infected, and you may well have the disease, and the degree of either not having had enough virus in the sample or false negative tests outright is much greater. So there's a lot more question. Except I was muted for that whole thing.
No, that was good. Thanks. Director Peters, introduced that this is probably more directed towards you guys because it has to do with Shutter Creek, but it says, why do you think that one of the smallest prisons in Oregon has the highest positive test rate?
So I have been asked many questions in the last few weeks, and that's the first time I've been asked that question. We don't know. We don't know for certain how the first AIC tested positive, and where they could have contracted the disease from, and that would be the answer to that question, because once that individual tested positive, then it was contained inside that institution. It was contained inside that institution, because yesterday was the first time that you had somebody test positive out in your community that we know of. And so, Dr. Dusnump, I don't know if you have any good medical answer for that. My answer, unfortunately, is I don't know.
Oh, the transparent answer is that we believe it came from another institution. We have another institution called Santiam in the Salem area. We have to go way back in our Wayback Meter here to when we first shut down visiting. Oregon and California, Washington shut down visiting, and pretty much all non-essential staff access in the March 12th, March 13th era, or excuse me, date range. And we did have transfers from Santiam to Shutter Creek prior to that time. And we have had people who became positive in Santiam prior to becoming positive, prior to recognizing positives about a month later in Shutter Creek. So at this time, the working hypothesis is that it came because of transfers before we shut down transfers from Santiam to Shutter Creek. Now, that's just a working hypothesis, but that's where the evidence points to at this time.
So, and then I guess to kind of flush out some of this question. So then, because you think it was transferred in from Santiam, and then the close proximity of all of the adults in custody based on the setup of Shutter Creek, maybe do you think why maybe there was a higher spread rate there based on other facilities?
Yeah, the densely packed nature of the congregate living facility in Shutter Creek and the dorm facilities in which the patients live as they prepare to re-enter as our new neighbors after release is unfortunately very conducive to spread. And these things, according to our symptom interviews, it went through pretty much like wildfire in the time period in March, around the time that we were first shutting down, again, when we first shut down visiting and non-essential personnel. So that all that spread occurred March to the beginning of April. And so right now most cases that we're dealing with are well into their post-symptomatic phase.
And this is really similar to the pattern that we see in long-term care, where the exact configuration of the housing itself leads directly to a significant potential spread of the disease. The most significant case at healthcare at Foster Creek in Portland have residents that were 3 to a room, where it's very, very difficult in that kind of a circumstance to control spread. And it really is kind of broadly analogous to that sort of a housing environment.
Sure, right. I think that I get that, I understand that, I guess, from what I didn't know before, and now I know. Thank you very much. Let me see here. Well, no. I think we pretty much got them all. I'll be darned. I didn't think that we'd get them all before 6:30, and we pretty much answered, in some form or fashion, pretty much answered the questions, all
Great.
that we have. Someone say something?
Great.
Great. Oh, yes, it is. That was great. Does anybody have anything they'd like to say before we sign off?
This is Senator Roblin. I just want to thank everybody that came on this and letting our community know what's going on. It took us a while to get it set up, and I'm sorry that it took us long, but I do know that there was a lawsuit that had to be dealt with. There were a lot of other kinds of things. I appreciate Commissioner Cribbins being on task and on this one from the very beginning, and my colleague, Representative McEwen, who has really been the lead from the legislative perspective. Thank you.
Well, I want to thank all of you again, as Senator Rowland said. Thank you all for being here. It means a great deal to us as the Public Health Division for Coos County to have the ability for the community to get answers straight from the people that might have them. We've tried our best over the last few weeks to move our way through this on our side, and it's nice to finally have everybody on town hall together so that the community can kind of get a better understanding of what we've got going on and how it's being addressed. So I want to thank all of you for your time. It was very nice being able to talk to you, and I hope that you have a great rest of your week and stay well.
Thanks for having us.
Thanks, everyone. Have a good night.
Thanks, Sarah.
Thank